Assalamu alaikum everyone. Welcome to the class of healthcare management. Today we are going to be doing responsibilities for patient care. We all know that the healthcare provider, the practitioner or the nutritionist, is responsible for the patient care, but the healthcare manager or mid-level manager who is supervising the nutritionist and the physician is also responsible for patient care, not just responsible for direct care, but through supervision and through monitoring, he is responsible for the care of the patient. Earlier, before the mids, this is our first class after the mids. Before the mids, we did other responsibilities of healthcare managers like staffing responsibilities, like fiscal responsibilities, responsibilities for hiring people and maintaining, for developing them. Today we are going to be doing responsibilities for patient care. The learning objectives of today's slides or today's chapter is to discuss the management needs of the professional employees. Do they need to be managed and how they do need to be managed? Utilization management and case management, and discuss the role of managers in utilization management and case management. These are the two new concepts that we are going to be doing in today's class, and we'll get to know what these two terms are. So the contents of today's lecture are managing the professionals, their needs, how to handle the work stress, and what managers can do to reduce the stress, providing the role of manager as a provider of the big picture of the perspective of the organization, utilization management and case management, and what roles and responsibilities do healthcare managers have for these two management. Managers are usually not, this is an introduction, usually not involved in the direct patient care. Private practicing nutritionists may spend at least half of their time in patient care, while mid-level managers in large organizations may be one or two steps removed from direct patient care. So, therefore, the healthcare managers have little or no contribution in the direct patient care. They are not directly treating the patients. Instead, they are managing the people, managing and supervising the people under them, subordinate to them. But in all the instances, managers have indirect responsibility for all the patient care provided by their subordinates. So they are indirectly responsible for the patient care. They must have a plan for monitoring the processes and outcome of that care and patients' responses. It's their responsibility to monitor the actions of the healthcare providers, and it is their responsibility to take patients' responses. Are they satisfied with the services or not satisfied? How the services could be improved. This chapter addresses patient care responsibilities of managers like managing the professional, utilization management, and case management. Quality care, patient satisfaction, and patient rights. We will do these three topics in the next lecture. Today we are just going to be focusing on utilization management and case management. Why do we need to manage the professionals? Healthcare managers do not have direct responsibility for individual patient or to therapist interaction. They do not interfere with the interfere in the interactions in the treatment being offered by the therapist or the nutritionist. Instead, direct patient care responsibility belongs to each nutritionist and extends to other staff members that the nutritionist directs and supervises. Nutritionist directs the assistant nutritionist, nutritionist directs the cook to provide the modified diet plans. So direct patient care is responsibility of the team, of the nutritionist, the assistant nutritionist, of the kitchen department and their employees, and the people who are going to be are analyzing their health status and are responsible for their dietary interventions. It is the deciding of the nutritionist when to utilize the assistants, and this should be based on this decision that the nutritionists want to utilize the assistants available should be based on ensuring safe and effective and efficient care at each treatment session. So it is their responsibility that to ensure that safe and efficient care is provided to the patient, and the assistants are completely supervised and guided in providing that treatment. The healthcare managers must provide an oversight of documentation for all services delivered by support personnel as well. So this is one of the responsibility of the manager, that they provide monitor the documentation process for all the people that are involved in the health of the patient. Nutritionists currently have a great deal of freedom in day-to-day patient care. They work autonomously. They are not answerable. They have complete freedom of their how they are going to treat the patient and how they are going to care for the patient. They are not answerable to someone. They are individually accountable for the care of the patients and the ongoing collaboration and consultation with other health professionals involved in the care of a patient to coordinate a patient's goal and plans to meet them. So they are not answerable, but they are working in collaboration and in consultation with the other health professionals in the team. Maybe if if there is a patient who has been admitted due to myocardial infarction, and he is being monitored for his vitals in an ICU, and he is being provided enteral or parenteral nutrition. The nutritionist is responsible for the maintaining the proper nutritional status of the patient, as well as collaborating with the physician, so that vitals when the vitals are being monitored, and if there are any she can the nutritionist can collaborate with the physician, or she can take the records from the patient files to change the plan of the enteral or the parenteral nutrition. Needs of professionals. It should be no surprise that professionals who assume such a high level of responsibility for care of others do not really require much management to fulfill their clinical responsibilities. So the professionals, the nutritionists, they have a responsibility for the care of the patients, and they are educated enough and they have much experience. So they do not require management for their clinical responsibilities. They require the managers for some other tasks that we'll be discussing later in the slide. These professionals, they can control their own work with a high degree after the assignments have been made, and may have a great deal of control in selecting the patients they will care for in some settings. Instead, professionals with strong technical skills, a good problem solving ability, sound judgment, and a sense of responsibility may need managers only to empower their actions, support them, assist with non-clinical problems that might arise, technical problems, maybe physical problems in the infrastructure, maybe, or maybe in some troublesome clients, managers may be called. They need assistance in providing performance feedback and performance appraisals, and reaffirm the vision, mission, and goals of their organizations. So the reaffirmation of vision, mission, and goals of the organizations need to be done uh, constantly, so that everyone is on the same page and works towards the betterment of the organization. Work stress is a major issue in the healthcare organization as the workload is uh, quite undivided and it is not equally distributed in the entire day. Managers play a role in reducing the sources of work stress, including heavy workloads, like in the OPDs where a huge amounts of people are coming. We'll discuss it later how they can help in reducing the stress related to it. Interprofessional role conflicts or ambiguities, sometimes where the nutritionists are settled from many years, there are lesser interprofessional conflicts. But when a new nutritionist is hired into a setting where there was no nutritionist before, there are interprofessional conflicts. People still now in these years are not ready to accept nutritionists sometimes as medical professionals. There's scarcity of resources and there is understaffing. Again, the workload would be increased. Physical strain, if there's any, emotional labor, maintaining and juggling emotions to present a socially accepted presence at all times. This emotional labor can be related to home or can be related to the work-home conflicts, management of the time, and limited input into the organizational decision making. When decisions are made by the organizations and the staff is not included in those decision making process, it increases the work stress and it lowers the morale of the staff, and therefore this all these factors can have an effect on the provider to the patient relationship. These stressors affect the physical and emotional health of employees, which then affects the patient care. Poor employee health is costly to organizations in terms of absenteeism, staff turnover, that they leave their jobs for better opportunities, or poor work performance may lead to clinical errors. So the patient outcomes can deteriorate too, and their treatment would be affected by the health performance because stress directly affects the health of the employee. And the organizations usually do not want all of these factors, so they are concerned about the mental health of the employees too. And what can managers do is help managers can help the employees deal with these stressors through several means, such as encouraging co-worker support as a coping mechanism. So they can make teams and they can provide somebody who is stressed can be provided with a co-worker support, and they can be attached to a person who is more mentally stable or someone who has been in the organization for last many years. Arranging flexible schedules so that workload is distributed, rewarding positive efforts to provide quality care, and encouraging high levels of control over their work. So how many patients they are going to take and for how many long time they are going to take uh, can be relieve their stress. The concept of the big picture, the concept of the perspective. Managers are responsible of to provide the big picture to the patients, to the people who are working in subordination with to them. So rather than micromanaging the patient care or managing at a small level and managing at the patient care, therapist wants managers to focus on interpreting the big picture of the healthcare policy, reimbursement, and organizational goals so that they may care for patients safely, efficiently, and effectively. So healthcare providers want a clear understanding, want the managers to interpret the healthcare policy, reimbursement plans, and organization goals to them. Reimbursement means how they are going to be paid when there are health insurers involved, how they are going to be paid back. The healthcare provider is going to be paid back. They want a clear understanding of these policies through the managers so that they can do their work effectively and without any stress or without any other concerns. Therapists may not want to be told what to do with patients, but they want to know why the organization functions as it does. So they need an explanation on the working of the organization rather than told what to do and how to do. They are educated, they are trained for treating the patients. They need to be not to be told that. They need to be told about the perspective and the bigger picture of the organization, the goals and the policies. Managers who provide this overall perspective and clearly delineate the roles and responsibilities of all the members of the rehabilitation service are appreciated. So, who provide this overall perspective, who clearly communicate with their staff are appreciated. So, communication is the key in managing effectively. Monitoring provider to provider, that is between the healthcare team and provider to patient, yani the doctor to the patient communication is essential to achieve coordination of care, which includes a coherent, that is understandable, harmonizing, working in complete coordination with shared responsibility for patient outcomes and healthcare results. So, this is the responsibility of the manager to monitor all this uh, paperwork and all this communication so that a harmony can be achieved and the healthcare and patient outcomes are improved. Now we'll be doing the concept of utilization management. The word utilization means the services, the management of the services, the management of the things that are being provided. This is a definition given by Institute of Medicine, Committee on Utilization Management by third party. By who are the third parties? Third parties are the insurers, who the insurance companies are the third parties, and utilization management reviews are done by these insurance companies who pay for the healthcare services that are being provided to the individuals. So when an individual is paying for themselves, utilization management and case management, both of the cases are not uh, done in those scenarios. Utilization management and case management, both reviews are done when some insurance companies or someone third person is paying for the. So the definition is this is a set of techniques used by or on behalf of purchasers of healthcare benefits to manage healthcare cost by influencing patient care decision making through case by case assessments of the appropriateness of care prior to its provision. So this is mostly done prior to the provision of the services, and this is an assessment of what type of health care should be provided to the patient so that healthcare costs are managed. So what is it? It is a technique to manage the healthcare costs, and assessment is done, decision making is done through case by case assessments. Is appropriate, is this the appropriate care or these are the appropriate services so that minimum cost could be paid to the hospital. This is another definition. Utilization management or utilization review is the use of managed care techniques such as prior authorization that allows payers, particularly health insurance companies, to manage the cost of healthcare benefits by assessing the appropriateness before it is provided using evidence-based criteria or guidelines. There are some guidelines present For example, for a myocardial infarction patient, a person may be, I'm just assuming, I do not know for details, may be kept in an ICU under observation for 3 days. A patient with pneumonia should be given maybe an oxygen mask or maybe sent to the ventilator to improve their breathing issues for these many days maybe. So there are some guidelines for each and every treatment, and this review is based on these guidelines. Another important component of a manager's responsibility for patient care is responding to the efforts of third-party peers to manage their cost and the quality of the care that they pay for. So the manager's responsibility is coordinating with these third-party peers or the insurance companies. They coordinate with them, they provide the uh, the reports of the doctors and of the records, so the utilization managers can effectively review and document. Controlling the utilization of services is now an expected component of healthcare. Third party peers may conduct utilization management directly or outsource it to independent review organization. These insurance companies can do the utilization management for themselves, and they can outsource it. They can conduct it through some other organization. Their reviews of patient care are based on written standards, which are drawn from historical data and typically approved or developed by physician panels in health insurance companies. So these standards are developed by the physicians, and the assessment is based on these written standards. Those conditions that are the most costly and most utilized or result in questionable outcomes receive the greatest scrutiny, but any patient's care may be managed for effective utilization. So this all is done mostly with the most costly techniques. So in any case, the purpose of these reviews is to determine whether patient care is efficient, effective, medically necessary, and appropriate. This is to basically to reduce the cost and to see if appropriate care is being given and there is no wastage. As a consequence, determining that quality standards have been met precedes payments to providers in essentially all inpatient and outpatient centers. After the quality standards have been met, this payments are done to the providers or the hospitals and by the health insurance companies. So there are types of utilization reviews, and this depends on the healthcare insurance provider, which type of review they are using. The reviews can be done before the treatment is started, during the treatment is being given, and after the treatment has been completed. So it can be done on any step. Maybe one technique is used, maybe multiple techniques can be used to review the utilization management. The first type is the pre-certification reviews. This process certifies the medical necessity of care before a patient can be admitted. Emergency admissions are reviewed within 48 hours. So what is done is that once a patient is admitted to the hospital, is brought to the hospital under severe conditions, and this type of utilization review is done before the treatment is started. Managers are responsible for providing information to the reviewers. The purpose of this form of review is to control cost before the admission. Next is the admission review. These reviews are conducted after a patient has been admitted for care to determine medical necessity and the appropriateness of inpatient care to determine the expected cost. This is done after the patient has been determined, after the patient has admitted. And this is often conducted on site in the large hospitals and within one working day. That was done within 48 hours. And this type of review is mostly done in a very emergency kind of state where the patient could not be held back so that he is reviewed. And this happens after the patient has been admitted. Now, the continued state or concurrent reviews, these are the ongoing reviews that are being conducted, especially for the patients who are there for a long period of time, who have chronic diseases like they are on dialysis and they are maybe they have had a stroke and they are now paralyzed, maybe something like that. So they are there for a longer period of time. These scheduled reviews apply to all admissions and are conducted periodically until a patient is discharged. These are done in frequent intervals. The intent of this review is to approve the continuation of care for only as long as necessary to reach the expected outcome. So this is done so as to determine whether the patient needs to be discharged or not to be discharged so that there is no wastage of resources. Identifying options for alternative, less expensive continued care setting is part of this process as a mean of controlling cost. So it is the responsibility of the reviewer to select an alternative healthcare setting where there can be services could be provided at a lesser cost. A discharge planning. The outcome of all these pre-certification reviews, continuous reviews, and admission reviews is to plan the discharge or how the patient is going to be sent home. This is a process of facilitating the transfer of a patient to an alternative, most appropriate setting when the goals of care have been reached. Either he can be sent to an alternative healthcare provider or they can be sent home. It begins when the provider or setting is notified of the certification of a patient's care. Including patients in the process has always been important. So it starts when the patient has been certified that he has been the treatment has been completed. Managers typically are not involved in this professional decision making process. This process is usually conducted by the physician or the provider, the healthcare provider. Retrospective reviews. This review occurs post-discharge and the same utilization standards used in other reviews continue to be applied. The obvious disadvantage of this type of utilization review is that involved parties do not know until after the fact whether or not the care provided was deemed medically necessary and appropriate. So in this retrospective review, they cannot assess whether the services that were provided were correct or not, whether they were necessary or not, and healthcare costs cannot be controlled and cannot be reduced through retrospective review because everything has happened. Managers represent their staff during any of these utilization management stages as important decisions are made from pre-admission to discharge of the patients. So managers represent their staff. Who are their staff? The physicians, the nutritionists, the physiotherapists. So managers are responsible for representing their staff. Managers must ensure the staff involved in direct patient care are prepared for the high level clinical decision making, involved in continued stay reviews and discharge plans in all settings. So, the review is conducted by the utilization managers, but it is the decision depends of discharge and continued staying depends on the healthcare providers. So the healthcare managers are the link between the utilization managers and the healthcare providers. Nutritionists may be called by the physician or the utilization review staff so that to provide data on patient's health and nutritional status. to provide data on the preparedness to wean off from the enteral and parenteral nutrition, and their ability to accept food, and their ability to be discharged. Now is the concept of the case management. The case management is done regarding the an individual. The utilization management was assessment of the services and the medical treatment that is being provided, whereas case management is regarding the individual person. Parallel process common in contemporary healthcare is the case management. This is also a technique to control the costs in by the hospitals, insurance companies, and employers, primarily directed to patients with high cost medical conditions, people who need high cost medical conditions, and people who need constant care and treatment. This is directed towards them so that costs can be controlled. Case management, this is the definition. It has 3 points of case management. This is a collaborative process of assessment, planning, facilitation, coordination, evaluation, and advocacy for options and services to meet an individual's health needs through communication and available resources to promote patient safety, quality of care, and cost-effective outcomes. So basically, the outcome of this case management is patient safety and quality of care is provided, but this is individualized to person. The case managers helps identify appropriate providers and facilities throughout the continuum of services while ensuring that available resources are being used in a timely, cost-effective manner in order to obtain optimum value for both the client and the reimbursement source. Patients may or may not have the option to use case management services. So these case management services are usually provided by the health insurance companies. So what happens is when a patient goes to a hospital, the case management professional is called upon so that he looks through the process. Okay, which type of provider is required, which type of services are required, and which would be the most cost effective techniques so that maximum value of the money could be obtained by the individual. So these are some duties of the case managers, what the case managers do. They screen to identify appropriate patients for case management services. So they will be called upon. They will be called upon by. They will be sent by the insurance companies, and they'll screen which patient needs more the case management services. Not each and every individual would be provided a case management services. Minor issues will be left to treatment by the decision making will be upon the healthcare provider on the hospitals. What kind of patients would be screened? Patients with high risk pregnancies, multiple traumas, or renal diseases. These all require ICU treatments or intensive care treatments. So these will be managed. They are responsible for planning and coordinating the delivery of care by the healthcare team. They will be looking into the uh, each and every aspect by the healthcare team, making discharge arrangements and following up with the patient. Evaluating the outcomes of care for each patient, checking benefits available and coordinating with other benefits. Patients has both Medicare and workers' compensation benefits, so they will be checking back and forth that the maximum uh, benefits are achieved by the patient and the outcome of the care is effective, and recommending insurance policy coverage expectations where appropriate. They are also responsible for coordinating referrals to specialists and arranging for other special services. Example, durable medical equipment. They are responsible for coordinating care with community services if the hospital services are no longer required and with the care could be provided with the help of community services. Like, for example, if the person is on the bed rest, he could be provided the bed rest at the home, and some community workers would regularly check him up and provide maybe food could be provided, or maybe support at home could be provided through community services. Verifying medical reasons for employee absences and educating the workers with chronic conditions. So what is the role of the healthcare manager in all the case management? The healthcare managers have to collaborate with the case managers for discharge planning decisions and represent the healthcare team. जिस तरह से utilization management में they were representing the healthcare team and they were a bridge between the insurance company and the healthcare team. Here again, the healthcare managers have a collaborative role. Managers need to keep abreast of the policy decisions and establish strong communication channels with the utilization managers and case managers so that they are prepared to address concerns of staff should conflicts arise in the decision making process. So if there's a conflict, like the hospital staff, the healthcare providers are do not think that discharge should be given to the patient, but the insurance company is keen on getting a discharge, so to reduce the healthcare cost. So managers need to be have a knowledge of the policies of the healthcare organization and the policies of the hospital so that the best decision could be made for the provision of the healthcare services to the patient. So this ends our topic over here. I'll provide you of a quick review that we have covered uh, today. Managers are not responsible for the direct patient care, but they are responsible for the actions of their subordinates, the people they are, the people, the healthcare providers who are working underneath them. They are responsible for the monitoring of their actions. They are responsible for providing documentation from all the people who are providing care. The practitioner do not need management. They don't need to be told how to treat the patient. They only require assistance in the non-clinical decision making and performance appraisals. Stress has a big negative role on the performance on the clinicians, and managers can reduce this by encouragement, providing work flexibility in their work to the clinicians, and positively rewarding their good efforts and their uh, good achievements. Managers are also expected to provide an overall perspective, the big picture of the organization, the goals and the vision and the mission of the organization, and if there are any policy changes and issues. Managers are basically responsible, we are the coordination between the organization and the clinicians. They are also responsible to monitor the provider to provider between the healthcare providers and provider to patient communication so that coordination is improved and the outcome of the patient care is improved. Utilization management, case management are techniques employed by third-party payers or the insurance companies to reduce the cost and ensure appropriate services are provided to the patients. So the basic aim is first of all to reduce the cost of both the techniques, and the second aim is to so that best patient care is achieved. Healthcare managers collaborate with the utilization management and case management teams to provide evidence and facilitate documentation and the decision making process. So they form a bridge between the healthcare providers and these teams, and they are the collaborative bridge between these two elements. And what is the aim? The aim is to provide the best care to the patient. So this ends our topic over here. In the next class, inshallah, we will be doing quality care in healthcare organization, how quality is ensured, what are their techniques, how patient satisfaction is measured, and how it can be achieved through guest relations, and what are the patient's rights and responsibilities when healthcare is being provided to them, and how can a manager be responsible for all these aspects. So I'll be closing it off over here, and we'll see you in the next class. Allah Hafiz.